After everything I shared this week, I want to talk about something that sits underneath it all. Why are people with sickle cell disorder still being labelled as drug seekers? Because this isn't random and there's a pattern behind it. People see someone in severe pain, asking for pain relief, often asking for opioids, and they make assumptions. But here is what is missing from that picture. People with sickle cell disorder are often introduced to opioids from childhood, not by choice, but by prescription. This is the clinical pathway for managing sickle cell pain. So when someone comes into A&E asking for the only medication they have known and the only medication that gets on top of sickle cell pain, that is not addiction. That is a patient following a treatment plan that has been given to them by their doctors. A sickle cell crisis is not mild pain. It's not just a little bit of discomfort. It is debilitating, whole body pain. Sickle cell pain is caused when misshapen, hardened, sticky red blood cells get stuck in blood vessels, capillaries, and arteries. And that causes excruciating amounts of pain. Ask any woman with sickle cell who has given birth. They will often tell you that labor is easier to manage than a sickle cell crisis. And it is commonly known, even by using NHS pain scores, that a sickle cell crisis is a more severe pain than a broken bone. So when somebody is asking for pain relief, when they are having a sickle cell crisis, they are not exaggerating. They are trying to cope with a pain that is overwhelming, a pain that takes your breath away, a pain that makes you unable to move. From a clinical perspective, sickle cell pain should be treated quickly and aggressively, because the longer pain is left unmanaged, the longer a sickle cell crisis will last. And this increases the risks of complications, and it causes a greater strain on the body. So when patients are left waiting hours for pain relief, this is not just poor care. It is clinically inappropriate, and it's clinical negligence. And I've experienced this myself. There was a point where I refused to take painkillers, let alone present to A&E when I had a sickle cell crisis, for fear of being labelled, fear of being judged. And so I would stay at home, often by myself, when I was having sickle cell crises, and not take anything to manage my pain. It got so bad that I was actually referred to the sickle cell psychologist to talk about it. And what I learned was this: managing your pain without pain relief is not strong, and it's not brave. It's dangerous, because an unmanaged sickle cell crisis can cause stroke, organ failure, and death. And the way we are treated is why so many sickle cell warriors delay going to hospital and delay getting treatment. They stay home longer than they should because they don't want to be labelled, they don't want to be judged, and they don't want to be mistreated. So by the time the vast majority of sickle cell patients come into hospital, their pain has already escalated. We are often more unwell and therefore more desperate for the pain to be stopped immediately. We also cannot ignore the role of bias. Sickle cell disorder predominantly affects Black people and, because of the mutations with thalassemia, other people of colour. And what we see time and time again are racialized judgments based on our perceived pain threshold, our pain tolerance, our credibility, and questions about our drug use. And this bias is not always conscious, but it's harmful. So from now on, when you hear the term drug seeking in a sickle cell context, I want you to question it and I want you to push back. Because in many cases, what you are seeing is not addiction and it's not drug seeking. What you are seeing is somebody in agonizing pain. They are asking for treatment that they have been prescribed. And they are doing this in a system that is not responding to them adequately. I hope this has given you a better understanding of the reality of sickle cell pain. Because when people get this wrong, people suffer unnecessarily. And in some cases, the consequences are far more serious than that. If this has helped you understand things differently, please share the video. These are conversations that need to be happening, and I will continue to have them.